Welcome to the deep dive. Today we're tackling a topic that's really crucial for anyone involved with dogs, especially if you're into breeding. We're talking about brucellosis.
That's right.
We've got this incredibly detailed text that we're going to unpack. Essentially, our mission here is to pull out all the vital info, what it is, the causes, the signs, treatment options.
Everything you need to know.
Exactly. So
Yeah.
you walk away with a really clear picture of canine brucellosis and, frankly, why it's so important to pay attention to.
Yeah, absolutely. We'll break down the core stuff, the definition, how it actually works in the body.
Right.
Then we'll get into the diagnosis, which can be tricky.
Uh-huh.
And finally, treatment. Think of this as your essential guide, all drawn straight from the source material we have here.
Perfect. Okay, let's dive right in then. Brucellosis in dogs. What are we actually looking at here? What's the basic definition?
Okay, so in essence, canine brucellosis is a contagious disease. It's caused by this specific bacterium, Brucella canis.
Brucella canis, got it.
Right. It's a gram-negative bug, and it likes to live inside cells, which is part of what makes it tricky.
Intracellular, okay.
Yeah. And the real hallmarks, the things it's most known for, are related to reproduction.
Mm.
So in females, you're often looking at things like abortion, infertility,
Oh, wow.
and in males, typically opididymitis, that's inflammation in the tubes, the back of the testicle, and testicular atrophy, where the testicles actually shrank.
So it really messes with their reproductive capability.
Big time. It basically throws a huge wrench into the whole system for dogs. Serious consequences.
You mentioned its focus on the reproductive system, but does it stop there? Or can it cause problems elsewhere in the body?
Good question. Well, B. canis definitely shows a preference for lymphatic tissue, the placenta in pregnant dogs, and those male genital tissues like the epididymis and prostate.
Right.
It's not strictly limited to those spots. It can also impact the hemic and immune systems, so think lymph nodes, spleen, even bone marrow.
So more systemic than just reproduction then?
Potentially, yes. Obviously, the reproductive organs themselves, uterus, fetus, testes, prostate, are directly affected. But less often, you might see it pop up in places like the intervertebral discs in the spine.
The spine, really?
Yeah, causing something called discus spondylitis, or the front part of the eye that's anterior uveitis, and even the meninges, the linings around the brain, and spinal cord.
Okay, so it has the potential to be quite widespread, even if those are less common.
Exactly. It's definitely more than just a reproductive disease.
That's quite concerning. What about which dogs get it? Is there like a genetic link? Are certain breeds just more susceptible?
Well, according to the text, there's no known specific genetic predisposition that makes certain dogs inherently more likely to get brucellosis.
Okay.
But, and this is interesting, it's seen most commonly in beagles. Significantly so.
Beagles. Any idea why?
The text doesn't really speculate on the why, just notes the observation. It also points to higher incidence in certain environments, not just breeds.
Like what kind of environments? Kennels?
Kennels, yes, especially breeding kennels. Now, figuring out the exact incidence, the number of new cases, is tough.
Why is that?
Because the standard blood tests, the screening tests, are notorious for false positives.
Ah, right. So a positive test doesn't automatically mean the dog has it.
Precisely. It's more like a, whoa, let's look closer signal. You really need confirmation with more specific tests. But looking at prevalence, how many dogs have it at any given time, studies show it's relatively low in the U.S. and Japan, maybe 1 to 18%.
1 to 18. That's quite a range.
It is, and it seems higher in rural areas of the southern U.S. But where you see a huge jump is in stray dog populations in places like Mexico and Peru. There, it can be like 25 to 30%.
Wow, that's a massive difference. Suggests things like population density, maybe lack of vet care play a big role.
That seems like a very reasonable inference, yeah. Geographically, it's found, as mentioned, in strays, pets, kennels across the U.S., often beagles involved there too, plus Mexico, Japan, several South American countries, but also Spain, Tunisia, China, Bulgaria. Even occasional outbreaks in Germany and the former Czechoslovakia, often linked to imported dogs.
So it's definitely a global issue.
It really is.
Yeah.
Especially where stray populations aren't well managed.
And it's mainly dogs, you said. What about other animals? Humans?
Primarily dogs, yes. The text states human infection is infrequent, which is, good news.
Definitely.
Breed-wise, again, no single breed is universally susceptible. But that high prevalence in beagles is worth noting. We also see cases in labs, other breeds, particularly in commercial kennel settings.
And age or sex? Any difference there?
No specific age preference mentioned, but it's most common in sexually mature dogs. Makes sense, given the reproductive link.
Right.
And while it affects both sexes, it seems to get reported a bit more often in females, maybe because abortion is such a noticeable sign.
Okay, that builds a clearer picture. So for someone listening, maybe a dog owner or breeder, what are the first clues? What might make them suspect brucellosis?
Well, a big red flag is obviously abortion in a female dog, especially if it's unexplained, or if there's a pattern of reproductive failure.
Like multiple missed pregnancies.
Exactly. Or small litters, stillbirths. In males, any kind of genital disease, swelling, pain, reluctance to breed should raise suspicion.
And are there other, maybe less obvious signs?
Yes, and this is important. Affected dogs, particularly females, might actually seem perfectly healthy otherwise. Or they might just show vague signs, like being a bit lethargic, maybe losing interest in mating.
Things you might easily miss or put down to something else?
Totally. Swollen lymph nodes are quite common, though. Some dogs might show back pain. And that abortion we mentioned, it typically happens around 6 to 8 weeks into pregnancy, but honestly, it can occur at any stage.
So even a seemingly healthy dog that suddenly aborts, brucellosis should be on the vet's mind.
Absolutely, it needs to be considered.
Okay, so the owner notices something, brings the dog in. What might the vet find during the physical exam that points towards brucellosis?
In male dogs, the vet might feel or see swollen scrotal sacs. Sometimes the skin there is inflamed to dermatitis.
Uh-huh.
On palpation, feeling the area, the epididymides might feel enlarged, maybe firmer than usual. If it's a more chronic, long-term infection, you could see the opposite testicular atrophy, so shrinking of one or both tests.
And the back pain you mentioned.
Yeah, they might find spinal pain on examination, maybe even neurological signs like weakness in the back legs or wobbliness, ataxia.
And what about other findings? Eyes, maybe?
Yes, that's another key one. Chronic recurrent inflammation in the front part of just one eye, unilateral anterior uveitis. This can happen even without other obvious signs of illness.
Just the eye.
Sometimes, yes.
Mm.
You might see changes in the iris color, maybe some cloudiness or inflammatory cells in the eye fluid, possibly inflammation deeper in the eye too, affecting the retina.
Interesting. Fever. Is that common?
Fever is actually rare with brucellosis, but enlarged superficial lymph nodes, the ones you can feel under the jaw, in front of the shoulders, in the groin, those are pretty common.
Okay. And females post-abortion.
They might have a persistent vaginal discharge for several weeks afterward.
Right. That's quite a range of signs, and like you said, some are vague. Let's talk cause. We know it's Brucella canis, but what makes this particular bacterium so problematic?
Okay, so Brucella canis, it's a gram-negative coccobacillus, sort of a short rod shape. Morphologically, under the microscope, it looks pretty similar to other Brucella species that infect, cattle or pigs.
Right.
But here's the kicker, diagnostically speaking. B. canis has this surface component, a lipopolysaccharide, that cross-reacts with antibodies against other, often harmless bacteria. Meaning it leads to a high rate of false positives on some common screening tests. We're talking maybe around 50%.
50%. That's huge.
It is. It's like that smoke detector going off constantly when you're just making toast. It causes a lot of unnecessary worry and follow-up testing. This is different from, say, B. abortus in cattle, where the tests tend to be more reliable.
So the bug itself makes diagnosis a bit of a nightmare from the start.
It certainly adds a layer of complexity, yeah.
What puts a dog at higher risk then? Where are they likely to encounter B. canis?
The text flags breeding kennels is a major risk environment. Also, packs of hounds, where dogs are kept in close quarters.
Makes sense. More contact.
Exactly. And the risk really skyrockets if a popular stud dog or brood bitch gets infected, because they can then spread it widely through breeding.
Oh, of course. Like a super spreader event.
Kind of, yeah.
Yeah.
And then there's the obvious risk from contact with infected stray dogs, especially in areas where brucellosis is endemic, where it's commonly found.
So close contact, reproductive activity, interaction with strays. Those are the main risk factors.
Pretty much sums it up, yes.
Okay, so given the vague symptoms sometimes, and these diagnostic hurdles with false positives, how do vets actually pin this down? What's the process?
It starts with differential diagnoses, basically ruling out other things that could cause similar signs.
Right.
So if a female aborts, the vet's thinking, could it be something wrong with the mother herself? A fetal issue, placental problems, or other infections like distemper, herpes virus, maybe even E. coli or lepto or toxoplasmosis.
Yeah.
Even other Brucella types like B. abortus could potentially be involved, though less common in dogs.
Lots to consider.
Definitely. And for a male dog with, say, scrotal swelling, You think about inguinal hernias, maybe other infections like fungal diseases, or even tick-borne stuff like Rocky Mountain spotted fever.
And the back pain, the discospondylitis.
Again, rule out other bacterial or fungal causes. So yeah, it's a process of elimination, carefully considering all the possibilities.
Not just jumping to conclusions. What about standard lab work? Complete blood count, chemistry panel, urinalysis, do those help?
Often, in straightforward cases, they come back surprisingly normal. Really?
Yeah. Now, if the infection's been going on for a while, become chronic, you might see some changes. Maybe high globulins, those are proteins involved in immunity, so hyperglobulinemia, sometimes low albumin, another protein.
Okay.
And if it has spread to the nervous system, causing meningoencephalitis, then testing the spinal fluid might show more white blood cells and higher protein.
And urine. Can you find the bacteria there?
You potentially can, but a standard urinalysis often looks normal anyway. So routine labs give clues sometimes, but they're rarely the deciding factor for brucellosis.
Okay, so we need more specific tests. You mentioned serology blood tests looking for antibodies. How reliable are those given the false positive issue?
Right, serology is the most common approach, but yeah, prone to errors. That false positive problem mainly stems from antibodies reacting to those lipopolysaccharide bits on the bacteria's surface, which other bacteria can share.
So the tests aren't specific enough sometimes.
Exactly. The first one often used is the rapid slide agglutination test, or RSA,
Yeah.
also called the card test or Rose-Bengal test.
RSA too.
Okay.
It's simple, it's fast. It can usually pick up antibodies maybe 3-4 weeks after infection. Its main strength is actually ruling out infection. A negative RSAT is pretty reliable.
So good for saying no.
Pretty good, yeah. But a positive RSAT, well, that high false positive rate, maybe 50%, means you absolutely cannot rely on it alone. It just signals the need for more testing. Confirmation is essential.
What other serologic tests are used for confirmation then? I see mentions of a mercaptoethanol tube agglutination test and AGID.
Yeah, the mercaptoethanol tube agglutination test, or TAT, is another one. It gives similar info to the RSA. It's maybe a bit more quantitative, but it also suffers from a lack of specificity, meaning false positives are still an issue. It's considered an okay screening test.
So still not definitive. What about AGID?
AGID stands for agar-gel immunodiffusion. There are a couple of types mentioned. One uses a cell wall antigen. It can be sensitive, but the method isn't standardized, and it also gives frequent false positives. So the text basically says, don't rely on this one.
Okay, not that one. What's the other AGID test?
The other one uses soluble antigens. These are proteins from inside the Brucella cell, not the surface stuff. This test is much more specific for Brucella antibodies.
Ah, that sounds better.
It is. The antibodies it detects usually show up a bit later, maybe 4 to 12 weeks after infection, but they tend to stick around for a long time. So this test can sometimes be positive even when the RS8 or TAT are negative or unclear.
So it might catch chronic cases the others miss.
Potentially, yes. It's considered highly recommended for confirming suspected cases because of that specificity. So sequences often RS8 screen, then confirm positives with the soluble antigen AGID.
That makes sense. Are there newer technologies like ELISA or PCR being used for diagnosis in dogs?
The text mentions an ELISA test using purified antigens from inside the bacteria, which sounds promising for accuracy, but it notes it's not commercially available for dogs yet.
Shame. And PCR, looking for the bacterial DNA.
Yeah, PCR is known to be very sensitive in human brucellosis, especially for early infections, often better than culture or serology. But again, the text says it's not yet a standard commercial test specifically for canine brucellosis.
So still relying heavily on serology and maybe culture then. What about imaging? X-rays, ultrasound, do they play a role?
Well, if a dog shows signs of that spinal issue, discospondylitis, on an X-ray, that finding should definitely trigger testing for brucellosis. It's a known potential cause. But the catch is, those spinal changes often develop slowly. The dog might have back pain long before anything obvious shows up on the X-ray.
So imaging is more supportive, not a primary diagnostic.
Exactly. It can add to the picture if discospondylitis is present, but it won't diagnose brucellosis on its own.
Okay. Beyond looking for antibodies or signs on X-rays, can you directly find the bacteria itself, like grow it in a lab?
Absolutely. Isolating Brucella canis by culturing it is the gold standard, the most definitive diagnosis.
How do you do that? Blood cultures.
Blood cultures are a key method, yeah. They work best if the dog hasn't had antibiotics recently. The bacteria are often present in the blood that's bacteremia, starting about 2 to 4 weeks after exposure. And this can go on for months, even years intermittently.
Wow, years.
Can happen. For females that have aborted, culturing vaginal fluid is usually very productive right after the abortion.
Okay. What about semen or urine?
You can culture semen or urine, but it's trickier because those samples easily get contaminated with other bacteria.
Right.
So it's not done as routinely. Sometimes special culture media with antibiotics are used to try and suppress the contaminants and let the Brucella grow.
Yeah, that makes sense. What about other procedures, like looking at semen quality in males or taking biopsies?
Yes, semen evaluation in males can be very telling. If they have epididymitis, you'll often see poor sperm motility, more immature sperm forms, and inflammatory cells in the sample.
When do those changes show up?
Usually become noticeable a few weeks after infection and can be quite dramatic by about 20 weeks. In really chronic cases with testicular atrophy, you might find no sperm at all as spermia.
And biopsies.
Biopsying an enlarged lymph node could be helpful. Microscopically, you'd see lots of immune cells, especially plasma cells. And if you use special stains, you might even see the bacteria inside macrophages, the cells that engulf invaders. Plus, you can culture the biopsy sample itself.
What about biopsying the testes?
If a testicular biopsy or sample is examined, say after neutering, you often see characteristic inflammation, sometimes with tissue death in blood vessel walls, necrotizing vasculitis, and those clusters of immune cells called granulomas trying to wall off the infection.
Okay, so quite a few avenues to explore for diagnosis, even if it sounds like putting pieces of a puzzle together sometimes.
It really can be, yeah. No single perfect test for every situation.
Once it is confirmed, what does the disease actually look like inside the dog? What are the pathological findings?
Grossly, meaning what you can see without a microscope, you'd often find enlarged lymph nodes and spleen. In males, as we said, enlarged, firm epididymides may be scrotal swelling or shrunken testicles. And signs of those other complications like the eye inflammation or the spinal lesions might be visible.
And under the microscope.
Microscopically, there's usually widespread activation of the immune cells in the lymphatic system. In chronic cases, lymph nodes show lots of plasma cells and macrophages, sometimes with visible bacteria inside them. The reproductive organs, prostate, epididymis, uteruses, often show infiltration by lymphocytes and those granuloma formations.
So inflammation is key.
Definitely. You can see quite severe inflammation, even necrosis or cell death, in the prostate and the sperm-producing tubules in the testes. And in the eye, you see signs of that granulomatous inflammation in the iris and surrounding structures, fluid leakage in the retina, and inflammatory cells in the front chamber.
It really paints a picture of a significant, persistent inflammatory battle going on. So shifting gears to treatment. A dog is diagnosed. What happens next? What are the options?
Generally, treatment can be managed on an outpatient basis. No need for hospitalization unless there are severe complications. If it's a working dog, restricting activity is usually recommended during treatment.
Okay.
But the most crucial part is client education. Owners have to understand the goal, the challenges, and the implications.
What specifically do they need to know?
They need to know the aim is complete eradication, getting the dog truly Brucella negative for at least 3 months, confirmed by tests. But that's not always achievable. Sometimes you might just knock the infection down to low levels.
Right. Manage expectations.
Exactly. And they need to know that antibiotic treatment, typically using drugs like minocycline or doxycycline, is often long, can be quite expensive, and frankly, the outcome is uncertain. Success isn't guaranteed.
That sounds like a tough conversation to have. Are there different recommendations depending on if it's a pet versus a breeding dog?
Yes, huge difference. The text is pretty clear. Treatment is generally not recommended for dogs in breeding programs or commercial kennels.
Why not?
Because even after treatment, there's a risk they could still shed bacteria or relapse, potentially spreading it to other dogs. The risk is considered too high in a breeding context.
So who is treatment recommended for?
Primarily for non-breeding household pets or dogs that have already been neutered or spayed. If an owner has an intact dog they want to treat, they must agree up front to neuter the dog or potentially euthanize it if the treatment fails.
That's a serious commitment, so neutering is often part of the plan.
Very often, yes, especially if euthanasia isn't an option the owner is willing to consider. Neutering alongside antibiotics helps reduce the risk of shedding the bacteria via reproductive fluids.
Are there other surgeries involved?
Not usually for the brucellosis itself. The main surgical consideration is the neutering spaying. Surgery for discus spondylitis is rare, usually managed medically if possible.
Oh, okay. What about the actual drugs? Which antibiotics work best?
The text suggests the most successful approach has been combination therapy, usually a tetracycline class antibiotic.
Like doxycycline.
Yeah, doxycycline or minocycline are common choices now, given orally for about 4 weeks. This is usually combined with an injectable antibiotic, dihydrostreptomycin, given for the first and last week of that 4-week period.
A combination approach. Are there drugs that don't work well?
The text specifically mentions that using enrofloxacin, which is a common antibiotic for other things, alone seems to have poor results against B. canis.
Good to know. Any warnings or precautions with the recommended drugs?
Yes. Tetracyclines aren't ideal for very young puppies because they can affect developing teeth and bones.
Right, the staining.
Exactly. And streptomycin, or sometimes gentamicin, which might be considered as an alternative injectable, can be tough on the kidneys. So they're contraindicated if the dog already has kidney problems, and kidney function needs careful monitoring if they're used.
Okay, so treatment is done. How do you know if it actually worked? What's the follow-up?
Post-treatment monitoring is critical. You need to do monthly serologic tests, those antibody tests, for at least 3 months. What you want to see is the antibody levels consistently dropping, ideally back to negative.
And blood cultures.
Yes, monthly blood cultures also for at least 3 months. You want those to be consistently negative too.
What if the tests become positive again? Or the antibody levels go back up?
That indicates a relapse or treatment failure. The options then are usually retreatment, maybe with a different protocol, or ensuring the dog is neutered and then retreating, or euthanasia has to be considered, especially for breeding animals, or if the owner can't manage potential ongoing risk.
It sounds really challenging to manage long-term, so prevention seems even more important. What can people do? Is there a vaccine?
No vaccine currently available, unfortunately. And even if there were, it would likely interfere with the serologic testing we rely on for diagnosis.
So no easy fix there. What then?
Prevention really hinges on testing and careful management. The recommendation is to test all brood bitches before every planned breeding.
Every single time.
That's the recommendation for maximum safety. Breeding males should also be tested frequently. And any new dog coming into a kennel or multi-dog home needs strict quarantine and testing. Tested twice, about a month apart, and negative both times before joining the group.
Strict biosecurity, essentially.
That's the best defense, yes.
What are the potential complications beyond treatment failure? And what's the overall outlook, the prognosis, for a dog diagnosed with brucellosis?
A major complication is often the owner's reluctance to neuter or euthanize a valuable animal if treatment fails. Vets have a tough ethical line to walk there, emphasizing the responsibility not to sell or spread infected dogs.
Yeah, I can see that being difficult.
As for prognosis, it's generally guarded, meaning you have to be cautious. Infections caught early, maybe less than 3 or 4 months old, seem more likely to respond to treatment.
And chronic cases.
Chronic infections, especially in males with established reproductive tract damage, are much harder to clear. Discospondylitis might need longer or repeated antibiotic courses. Ocular disease can sometimes be managed with combination drugs.
And if treatment is successful, are they immune?
No, that's a crucial point. Successful treatment does not lead to immunity. A dog that's been cured can easily get reinfected if exposed again.
So vigilance is key, even after successful treatment.
Always.
Wow. Okay, this has been an incredibly thorough deep dive. Just to recap the main points, brucellosis is this contagious bacterial disease heavily impacting reproduction in dogs.
Right. Abortion, infertility, epididymitis.
Diagnosis is a real challenge because of vague signs sometimes, and especially those tricky false positives with screening tests needing careful confirmation.
Definitely a hurdle.
And treatment is complex, often lengthy, expensive, not always successful, and carries major implications, especially for breeding dogs, often requiring neutering.
That sums it up well.
Yeah.
Awareness is just so critical for owners, breeders, vets, testing, responsible management. That's our main strategy right now.
It really makes you think, doesn't it?
Yeah.
Considering all these difficulties, particularly in diagnosis and the treatment limitations, what's the next step? What kind of research or advancements could really move the needle for dogs affected by brucellosis?
That's the big question. Maybe faster, more accurate point-of-care diagnostics, more effective, maybe shorter antibiotic protocols, perhaps even work towards a safe vaccine that doesn't interfere with testing.
Lots of potential avenues. It certainly highlights why ongoing veterinary research in this area is so vital. This has been incredibly informative. Thank you for sharing all that detail with us today.
My pleasure. It's an important topic to understand.